This year, Bellin Health recognizes Michong Powers as the Carol and Robert Bush Excellence in Nursing Award winner. Intensive Care Unit Staff Nurse Michong Powers loves nursing and continuous learning. In fact, she has earned 5 different certifications, the most of any nurse at Bellin. What drives her? It's a passion to provide the best patient care possible.
The reason I nominated Michong for the Carol and Robert Bush Nursing Award is Michong is extremely important to the Bellin experience. She not only helps patients in the ICU, she helps her coworkers, she helps other departments, and we are better as an organization because of her. Michong approaches face-to-face patient care by really getting to know the patient. She makes a very, very personal experience.
I approach my patient with respect. I put myself in their positions, and then as a patient, probably it is the first time for them, even though I take care of the same types of a patient every day for the last 15 years. So I try to take care of them as it is my first time.
I don't think Michong will ever be satisfied with what she currently knows. She's always looking at the next level. What else do I not know? What can I become an expert at?
When I made the transition to ICU, I had to study hard in order to know the patient's diagnosis, in order to know the treatment. After that, I studied CSC, which is cardiac surgery certifications, because I was orientating most of our young nurses who made the transition to level 3, which is open heart nurses. Then once I got that, I decided to go for the cardiac medicine certification, which was very hard to get because it covered the majority of majority knowledge.
Michong works in multiple departments. She's an ICU nurse first, but she has managed to cross-train herself into other departments. So I can think of a weekend shift, ICU, she's scheduled in the ICU, very slow. So they needed help in the ER, so she floated down to the emergency room. While she was in the ER, a patient came in needing a cardiac catheterization for a STEMI. Cath lab crew was not here yet, but the cardiac doctor was. The charge nurse in the ER, realizing that she had a great resource in Michong, allowed her to go up to the cath lab. So Michong was the cath lab crew with the doctor. And this patient hit the door, went right up to the cath lab, got an emergent catheterization, and they came to the ICU. So essentially what you saw is you had one nurse, one patient, 3 different departments. That's an experience that just does not happen. It's the Bellin experience. Michong did that. She does a great job with that. And now several other nurses have followed suit and done the same thing, where they are cross-trained into these other departments. She's led the way, and it's been very, very helpful to Bellin.
The advice that I can give to my colleague and the young nurses is challenge yourself, and our patients do deserve the best care we can provide. When you challenge yourself in terms of learning, and you can provide a much in-depth knowledge base.
I have no doubt that when Michong is on, the standard of care is exceptionally high, and the people that work with Michong, they expect themselves to have the standard of care that is met at Bellin consistently.
When I walk out of here after 12-hour shift, even though my body and mind are tired, I am just happy every day. I can't make a list long enough to say all the names that I need to say. First, Jason, thank you for nominating me. And thank you to Carol and Bob Bush. And I really appreciate their generosity. And I also thank all my colleagues who's been supporting me all these years.